Good evening, doctors. On behalf of HITRO, I, Dr. Prashant, welcome you to this webinar on influenza and its prevention. HITRO Healthcare, as you know, an innovative pharmaceutical company. Our journey began in 1993. We have 30 years of excellence and 36 state-of-art manufacturing facilities, 300 plus products in our portfolio, and 21,000 employees globally. We are amongst the largest manufacturers of ARV, APIs, and FDFs in the world. And Hito Healthcare is Asia's largest API manufacturing facility at SEZ Complex, Visakhapatnam, Andhra Pradesh. Hito Healthcare is 360-degree solution provider striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties, pioneering in quality and innovation, and we have distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, the Hetero Healthcare, the pioneer in antiviral, offered fluvelvir, that is oseltamivir, favipiravir, and remdesivir, for which Hetero Healthcare received Award of Pharma Excellence in August 2020 for COVID drugs. Today's webinar, Influenza and its Prevention. We all know the necessity of prevention of influenza, otherwise the turn influenza can take. Although there are many papers, we'd like to have our own doctor's experience on this, for which today we have got Dr. Rajendra Salagare and Dr. Nageshwar Narayan Rao. Welcome, Dr. Rao. Dr. Rajendra Salagare will join us after some time. Sir is MD, MBBS, MD, sorry, consulting pediatricians, Salagare Children and Hospital, EB member CIP 2023, President Belgavi IIP, Vice President Karnataka IIP Belgavi Division, Vice President KIP Respiratory Chapter, established AHA unit at Belgavi, conducted many school and public health programs. Sir has completed PEM Pediatrics, completed Advanced Asthma course, and completed adolescent PG diploma from DY Patil University, Pune. Dr. Salagare will join us after some time. Dr. Nageshwar Narayan Rao is here. Sir is MBBS DNB, gold medalist, PGD MCH, Bidar, Karnataka. Clinical experience in Nice Hospital, Hyderabad, Mahavir Hospital Research Center, Hyderabad, India, Mahadevappa Rampur Medical College, Gulbarga, Karnataka. Sir has trained graduates from Care Hospital, Hyderabad, trained postgraduate DNB students, trained nurses in NRP and neonatal nursing protocol, trained nurse staff with PICU, faculty instructor of pediatric advanced life support. Dr. Nageshwar has performed several procedures both in neonates and in children and has presented in many seminars and conferences. Welcome to this webinar, Dr. Nageshwar Rao, and I hand over the session to you.
Thank you, sir.
I stop sharing.
Yes. I'll start sharing my PPT, sir.
Yes.
Fine. Okay. So good evening all. I am Dr. Nageshwar Rao. First, I would like to thank Team Hetero for giving an opportunity to present a seminar on oseltamivir. So without wasting much time, we'll like to proceed with the throwing some light on the oseltamivir and its uses in the flu management. Coming to the contents, how this presentation will be in the following subheadings, like it will be healthcare challenges in monsoon and their diagnosis, influenza and its complication, clinical evidences of oseltamivir, and what are the guideline recommendation for empiric use of oseltamivir. As we all know, whenever there is a change in the season and whenever we come across monsoon, we do get so many cases like of influenza-like illness. Of them, some may be H1N1 positive. Very rarely, few patients go into severe acute respiratory illness. And few years back, we had a very bad experience with COVID-19 also. So with this background, so how this influenza virus occur and what is the occurrence and when this pandemic occur, whenever epidemic occurs, there was a study which was done in Chennai, Tamil Nadu. This study lasted for more than 7 years, and this study was done by Department of Virology in 2019 at the King Institute of Preventive Medicine and Research, wherein they have analyzed 36,670 specimens for influenza analysis. And they have found in this study, like influenza positivity started with the onset of monsoon, and this infection peaks during the post-monsoon months. And the results of this study were also published in Indian Journal of Medical Oncology. So this is an overview of influenza infection in India. Uh, this blue bar diagram represents 2015, red is 2018, and green is 2019. In this first diagram shows the number of cases of influenza virus, whereas the second bar diagram shows the number of deaths due to influenza virus. So this is a magnitude of problem and the incidence of death in the influenza infections. So what is influenza virus? It is one of the most common infectious disease which is caused by influenza virus. Again, type of influenza virus we are going to see in the subsequent slides. And this is highly contagious airborne disease that occurs in seasonal epidemics, like what we seen as monsoon season. And it usually manifests as acute febrile illness. The disease caused by influenza virus can range from mild flu-like illness to severe illness. And serious outcome of flu infection can result in hospitalization for longer time, requiring invasive respiratory support and even death in few cases. So coming to the type of influenza virus, it is ABC. Actually, influenza viruses are classified as type A, type B, and type C. Influenza A virus causes frequent epidemics due to minor antigenic variations and periodic pandemics due to major antigenic variation. Whenever there is minor antigenic variation, it results in epidemics, whereas in major antigenic drifts, they lead to periodic pandemics. Whereas influenza B virus, it can infect only humans and it can cause only local epidemics. Influenza C virus, it can infect both humans as well as swine. So influenza C infections generally cause mild respiratory illness and are not thought to cause any epidemics or severe illness. Currently circulating influenza virus in humans are presently subtype A H1N1 and A H3N2 influenza viruses. How these flu viruses are transmitted? Any people with flu can spread it to others up to distance of 6 feet by the coughing, sneezing, screaming. Even in our OPDs, when children get into OPDs, they try to cry a lot because of fear. So even that act can transfer the flu infection. Even the waiting areas where the normal child has come to some other problem or vaccination, this flu child, if it is sitting and crying, virons get released into environment and that can spread flu infection. These are mainly spread by droplet when people with the flu usually cough, sneeze, talk, or and in pediatric cases even crying also. So these droplets can land in the mouths or noses of the people who are nearby and or possibly inhaled into the lungs. So people should stay away from the affected person and stay home if sick. And it is also important to wash hands often with soap and water. So most healthy adults may be able to infect other people beginning from day one, beginning one day before the symptom develops. So if the patient has developed the symptoms of flu-like illness today, so he was transmitting the virons and viruses since yesterday only. So, and this may develop up to 5 to 7 days after becoming sick. So that is the period where the infectious person has a very high probability of spreading the infection. And children may pass the virus as long as 7 days also. So here is a differentiation between the various type of flu-like illnesses. One is influenza-like illness, second is H1N1, third is severe acute respiratory infection, and fourth is COVID. In all the cases, fever, myalgia, cough, lack and energy, and sore throat. These are the 5 symptoms which are seen in all the 4 types of infection. Whereas breathlessness may or may not be there in influenza-like illness, but it is definitely there in H1N1, SARI, and COVID-19 infection. Loss of smell, loss of taste. This was the most common symptom during the COVID days. So it is seen in COVID-19 infection. Diarrhea is usually seen in COVID-like infection. Headache is usually present in H1N1 type of infection, may or may not be present in ILI, SARI, and COVID-19 infections. So coming to the ones the patient is in our staff or the reception team should be become alert and inform doctors early is whenever any children who has come with a fast breathing or difficulty in breathing, who has bluish skin color or cyanosis, not able to drink enough fluids, not waking up or not interacting, like the child is very lethargic or irritable, that the child does not want to be held, and flu-like symptom improve but then return with fever and worse cough, and any child with feverish rash. Along with that, if the child is small, like infant, less than 1 year, the additional signs which are to be seen are being unable to eat or feed, has trouble in breathing, has no tears while crying, and significantly fewer wet diapers than normal. It means it is oligurate. In adults, the warning signs are difficulty in breathing or shortness of breath, pain or pressure in the chest or abdomen, history of sudden dizziness, feeling of confusion, severe or persistent vomiting, and flu-like symptoms that improve but again return with fever and worse cough. So, how this simple flu-like illness can lead to complication? It can lead to pneumonias, bronchitis, ear infection, worsening of the existing disease like asthma, COPD in a sensitive patients. They may present with acute respiratory distress syndrome, and in the few cases, even death also. So, how to manage influenza now? So treatment is again divided into supportive treatment and definitive treatment. Again, treatment is largely supportive, which consists of bed rest. We should ask that person, if infected, to take adequate bed rest, increase the fluid consumption to maintain the hydration, use of cough suppressants if cough is more, antipyretics and analgesics such as paracetamol, and NSAIDs for fever and severe myalgias. With this symptom and a good immunity, most of the patients with influenza recover in 3 days. However, body pains or malaise or weakness may persist for 1 to 2 weeks. And whereas in severe cases may require intravenous hydration and other supportive measures. So the earlier slide was about the supportive treatment. Now coming to the definitive treatment. Definitive treatment is to target the virus. In this antiviral drugs, we have two types of drugs. One is neuraminidase inhibitor, another is adamantanase inhibitor. So the neuraminidase inhibitor examples are oseltamivir and zanamivir, whereas adamantanase inhibitors are amantadine and rimantadine. Here we will be dealing with the oseltamivir, which is a neuraminidase inhibitor. Antiviral therapy with oseltamivir. So oseltamivir is a potent and selective inhibitor of neuraminidase enzyme of the influenza virus A and B. So it mainly acts against influenza A and influenza B. Oseltamivir is a product which once ingested is converted into the active form oseltamivir carboxylate in the liver. It inhibits influenza virus replication and pathogenicity and further prevents spread of infection. It is effective against all strains of influenza type A and type B. So this is the diagram where the neuraminidase activity inhibits the neuraminidase enzyme of the viron, which is required for entry of this virus into the cell, multiplication and lysis of the cell by releasing the virus. The main action of neuraminidase is inhibited by oseltamivir. So oseltamivir is said to be the first oral neuraminidase inhibitor, and this drug is approved in more than 100 countries with good safety profile. So oseltamivir drug and dosage recommendation. In adults, it is standard 75 mg capsule twice daily for treatment. If you want to give prophylaxis, like any of the family member is affected with flu-like illness and they have some sensitive population or a child with asthma or an adult with asthma or COPD or any person with chemotherapy or decreased immunity, then we can give them as chemoprophylaxis 75 mg capsule once daily. When coming to children, again in infants, 2 weeks, we can start this drug from 2 weeks onwards to less than 1 year of age. The recommended dose for treatment is 3 mg per kg twice daily, whereas prophylaxis is not recommended in this age group. Coming to the children who are less than 15 kgs, it is 60 mg per two divided doses, whereas 15 to 23 kg, 90 mg per day. 23 to 40 kgs, it is 120 mg per day, and more than 40 kgs, it's 150 mg per day. The same dose is half the dose for chemoprophylaxis. Like for children less than 15, it is 30 mg OD for chemoprophylaxis. Between 15 to 23, it is 45 mg. 23 to 40, it is 60 mg, and more than 40 kgs, it is 75 mg. So more than 40 kgs, again, it resembles the adult dosage only. What are the clinical trials which are done to show that there is early use of oseltamivir will decrease the morbidity of the patient? So this oseltamivir is said to be the wonderful drug for walking pneumonias. Here is one case scenario where 50-year-old man, farmer by occupation from India, with no underlying comorbid condition, was referred to one of the tertiary center in Srinagar. Patient had presented with the complaints of low-grade fever, sore throat, and myalgia and sore throat for 7 days. He had no history of chest pain, breathlessness, orthopnea, vomiting, or diarrhea. So before referral, he had received antibiotics in the form of ceftriaxone and levofloxacin, but there was not much improvement in this person. Then on examination, it was found that his pulse was 110 per minute, with the BP was 110 by 72, and temperature was 100 degree Fahrenheit. Chest examination revealed bronchial breathing associated with bilateral force steps in inframammary areas. His creatinine, phosphokinase, and LDH levels were high. Mid-zone interstitial infiltrates were seen on chest radiograph. Nasopharyngeal swab was taken in this patient as he was not responding to routine medicine, and hence PCR revealed it was positive for H1N1 influenza type A virus. CRP levels were low, it was showing 10 mg per liter. Cardiovascular system, abdomen, and CNS system were examination were normal. Lab evaluation revealed normal hemogram only, along with normal leukocyte count. Your function test were normal and ECG was normal. This is the X-ray of this person where it is showing mid-zone interstitial infiltrates. For this person, oseltamivir was started in a dose of 75 mg BD for 5 days. Along with that, he received analgesics for headache, body pain, and fever. He was advised for good oral hydration and hand wash. After starting oseltamivir, patient showed a marked improvement in his symptoms with progressive decrease in CPK and LDH levels and subsidence of infiltrations on chest radiography when compared to the previous X-rays. So this X-ray is better than the previous one. The infiltrates which were there in the mid zones and pericardic region have come down. So with this, we get few clue like oseltamivir treatment of influenza-like illness reduces the LRTC, antibiotic use, and hospitalization. So this was a prospective study. So in this study, what they have done is that they have used antibiotics for 3,564 subjects age in the different age range of 13 years to 97 years who have presented with influenza-like illness and enrolled in the 10 placebo-controlled double-blind trials of oseltamivir. So in patient with influenza, oseltamivir treatment reduced antibiotic use by 26.7%, influenza-related antibiotic therapy by 55%, and hospitalization by 59%. This is a very significant number. So, reducing occurrence and severity of pneumonia due to H1N1 by early oseltamivir administration. Again, this is a retrospective medical chart review of 442 patients was conducted with the median time from symptom onset to oseltamivir administration was 5 days here. So again, subjects were divided into 4 groups based on the time the oseltamivir administration was started. So one group was like oseltamivir started with less than 2 days. Like on the day of feeling like flu-like illness, they have started oseltamivir. Second group was between 3 to 7 days. Third was 8 to 14 days. And fourth was more than 14 days. What they have seen is both the probability and severity of pneumonia and the probability of severe pneumonia increased gradually with the time from symptoms onset to oseltamivir administration. So what does it mean is earlier initiation of oseltamivir administration after symptom onset significantly reduced the occurrence and severity of pneumonia, and also it has shortened the hospitalization due to pandemic in H1N1 in 2009. Even when administered 48 hours after symptom onset, oseltamivir showed considerable potential for reducing the pneumonias. So it is earlier the better. This chart indicates that earlier the better. Again, the patient with shorter time to oseltamivir administration will discharge earlier from the hospital. There was one more study which was conducted Along with azithromycin, they have given oseltamivir as a combination therapy to reduce the secondary bacterial infection. Again, this is a retrospective observational study. And they have divided patient into one group was comprising of 227 patients where they received oseltamivir and azithromycin therapy for at least 3 to 5 days. Other group of one or two patients, other cohort of one or two patients received only oseltamivir for 3 to 5 days. They have seen that the oseltamivir and azithromycin combined treatment offered significant reduction in the incidence of secondary bacterial infection and required less respiratory support. Again, oseltamivir and azithromycin combined treatment offered significant reduction in the hospital stay and influenza symptom severity score. So, what are the guidelines to start oseltamivir now? So, World Health Organization recommends empirical treatment is strongly approved here. Whenever there is a at-risk population, treatment should be started as soon as possible because we have seen that earlier we start the oseltamivir, less was the results of complication and early recovery was noticed. Similarly, lab confirmation of influenza virus is not necessary for initiation of treatment because when the virus affects the person who is in a resource limited setting. Sending PCR for influenza virus sometime may not be possible. So lab confirmation, we should not wait for the lab confirmation. If you feel like the clinical features are in accordance with the flu-like illness, then it is better to start oseltamivir. Negative lab test for H1 does not exclude the diagnosis in all patients. And if high-risk individuals have been exposed to the patient with influenza, so consider presumptive treatment with oseltamivir. So an early empiric supportive therapy and monitoring. Empirical antibiotic treatment should be based on the clinical diagnosis. So if you feel like empiric therapy include a neuraminidase inhibitor for treatment of influenza, then there is a local circulation of or other risk factor, including travel history or exposure to animal influenza viruses. This is the statement given by Ministry of Health and Family Welfare, Government of India. So again, in adults with community-acquired pneumonia who test positive for influenza, should the treatment regimen include antiviral therapy? Here, the recommendation is that anti-influenza treatment such as oseltamivir may be prescribed for adults with community-acquired pneumonia who test positive for influenza in the inpatient setting, independent of duration of illness before diagnosis. So, strong recommendation with moderate quality of evidence. It is not like the patient has come after 7 days, so you are not going to start oseltamivir. If you find that there is a positive for influenza, it is better to start whenever we get the diagnosis. Second is several observational studies suggest that treatment with oseltamivir is associated with reduced risk of death in patients who are hospitalized for community-acquired pneumonia and who have tested positive for influenza virus also. So treatment within 2 days of symptom onset or hospitalization may result in the best outcome, although there may be benefits received even if we start on 4th or 5th day of beginning of the symptom. So to summarize, proper diagnosis and early treatment can prevent flu and its complication. Empiric use of oseltamivir reduces lower respiratory tract infection, hospitalization, and antibiotic use. And World Health Organization, American Thoracic Society, and Ministry of Health and Family Welfare recommends empiric use of oseltamivir whenever you find a at-risk population or there is a monsoon season, or if you find that epidemic is going on, or you find old age person who is having COPD or at-risk population. So it is better to start oseltamivir before we get a diagnosis. So, this is all about oseltamivir.
Thank you, Dr. Rao.
Thanks.
Thank you very much. Similarly, do we have cases of? We don't have cases of Dr.
Sir's presentation is with him only.
Him only, no?
Um,
Sabrati, can we leave then?
right, sir. If sir has not joined, then we can.
Yes.
But if you have any questions, like we can ask Dr. Rao.
We don't have any specific questions.
No, because from audience also I've not received any.
Yeah. Okay, then,
Right, sir.
Thank you so much then, Dr. Rao. Thank you so much for your inputs. I'm sure the audience must have benefited out of it. Thank you.
Thank you, sir.
Yes, thank Field People Hitro for their coordination and IT team for their support and marketing team for conceptualization. Thank you, everybody. And thanks, doctors, for taking time and attending this webinar. Thank you for taking time from your busy schedule and attending this. Thank you very much. Thanks, all of you. And then signing off, wish you a very pleasant evening. Thank you.
Thank
Thanks,
you.
Dr. Rao. Thank you. Thanks, Shashidhar.
Okay.
You can leave now, Shashidhar.
Yes, sir.